Have you ever taken vitamins thinking they were helping you stay healthy, only to notice your legs feeling weaker over time? You might be surprised to learn that some common supplements, taken in excess, could be causing harm instead of good. Many seniors rely on vitamins to improve their health, maintain strength, and stay active. However, certain vitamins, when overconsumed, can actually contribute to muscle weakness, poor circulation, and even nerve damage. These issues can severely affect your leg strength, which is vital for mobility and preventing falls. In this video, we'll explore how some commonly used vitamins could be secretly damaging your leg muscles. You'll learn how taking too much of the wrong kind of supplements can result in negative side effects that you may not even be aware of. If you've ever felt like your legs are getting weaker despite your healthy supplement routine, this video will explain why. We'll also give you insights on how to adjust your vitamin intake for optimal health without compromising your leg strength. Let's dive in and discover the hidden dangers that could be affecting your mobility and how you can avoid them to stay strong and active. Section 1. Vitamin E. Vitamin E is often praised for its antioxidant powers, protecting cells, boosting the immune system, and supporting healthy skin and eyes. It's found in foods like almonds, sunflower seeds, spinach, and vegetable oils, and is a common ingredient in multivitamins. But for seniors, too much of this essential nutrient can have unexpected consequences, particularly on leg strength and mobility. Many older adults assume that taking high-dose vitamin E supplements is a healthy choice, believing that more is better. But in reality, large doses can interfere with vital bodily functions. Seniors, whose bodies are already experiencing age-related changes in muscle and nerve health, may find that excessive vitamin E does more harm than good. One major concern is muscle weakness. High levels of vitamin E can disrupt the balance of other nutrients like vitamin K, which supports blood clotting and bone health. This imbalance may weaken muscle tone and lead to reduced coordination, especially in the legs. Seniors may notice they tire more easily, have difficulty climbing stairs, or feel unsteady while walking. Vitamin E's anticoagulant blood thinning properties can also become dangerous when taken in excess. While thinning the blood may prevent clots, it can also reduce oxygen delivery to the muscles. Poor circulation in the legs can cause cramps, fatigue, and diminished endurance, making daily activities more challenging. Another issue is how vitamin E affects mitochondria, the cell's energy producers. In small amounts, vitamin E protects these structures. But in excess, it can actually impair mitochondrial function, leading to slow muscle recovery and chronic fatigue. Since seniors already face age-related mitochondrial decline, high-dose supplements may worsen the problem and accelerate muscle loss. Neurologically, too much vitamin E can cause oxidative stress in nerve cells, particularly if taken without balancing nutrients like vitamin C and selenium. This may lead to neuropathy, numbness, tingling, and weakness in the legs and feet. This not only affects sensation but also disrupts motor control, leading to unsteadiness and falls. Medication interactions add another layer of risk. Many seniors take blood thinners like aspirin or warfarin. When combined with high-dose vitamin E, the risk of internal bleeding increases, sometimes in the leg muscles, causing pain, swelling, and impaired movement. Vitamin E also crosses the blood-brain barrier, affecting neural communication. High levels can disrupt the brain's ability to coordinate muscle movements, leading to balance issues and falls. This can spiral into emotional distress, social withdrawal, and increased sedentary behavior, further weakening leg muscles. A key concern is that many supplements contain synthetic vitamin E, which is less effective and may increase toxicity risk. Additionally, some capsules contain up to 1,000 IU, many times the 15 milligrams recommended daily for older adults. Unlike water-soluble vitamins, excess vitamin E isn't flushed out easily. It builds up in the body, increasing the risk of long-term harm. Research backs up these concerns. A major study published in the Journal of the American Medical Association found a link between high-dose vitamin E and increased mortality in older adults, raising serious safety questions. So what should seniors do? First, prioritize a food-first approach. Natural sources of vitamin E, like nuts and leafy greens, are generally safe and sufficient. Before starting any supplement, it's best to consult a doctor and check for deficiencies through blood tests. If supplements are needed, they should be medically supervised and carefully dosed. In conclusion, while vitamin E is important, excessive supplementation can threaten leg strength and overall mobility in seniors. From muscle and nerve damage to harmful drug interactions, the risks are real. A balanced diet, regular exercise, and professional medical advice remain the best strategies for healthy aging. When it comes to vitamin E, less truly is more. Section 2. Vitamin A. Vitamin A is an essential fat-soluble vitamin that supports vision, immune health, skin repair, and cell communication. Naturally found in liver, dairy, fish, and plant-based foods like carrots and sweet potatoes as beta-carotene, it plays a key role in overall wellness. However, in older adults, vitamin A can quietly shift from helpful to harmful, especially when consumed in excess. Unlike water-soluble vitamins that are flushed out through urine, vitamin A accumulates in the liver and fatty tissues. This can lead to a condition known as hypervitaminosis A, where excessive levels disrupt body functions. For seniors who experience slower metabolism and altered nutrient regulation, the risk of toxicity is significantly higher. One of the most serious concerns with too much vitamin A is its impact on bone health. Research shows that high levels interfere with vitamin D and calcium, weakening bones and increasing the risk of fractures. This is particularly troubling for the elderly, as fractures can reduce mobility and lead to further leg muscle deterioration. A vicious cycle begins. Weak bones limit movement, inactivity causes muscle atrophy, and declining leg strength threatens independence. Beyond bones, muscle function suffers as well. Excess vitamin A can disrupt mitochondria, the energy generators of cells, leading to fatigue, muscle pain, and decreased endurance, especially in the legs. This loss of energy and strength makes simple tasks like standing, walking, or climbing stairs more difficult, contributing to a sedentary lifestyle that further worsens muscle loss. Additionally, neurological symptoms can emerge. High vitamin A levels may increase pressure inside the skull, causing headaches, blurred vision, and coordination problems. This affects balance and walking ability, increasing the risk of falls and injuries. In some cases, seniors may exhibit tremors, delayed reflexes, or abnormal gait patterns. A critical issue with vitamin A toxicity is its silent progression. Seniors may unknowingly consume high levels through multivitamins, fortified foods, or popular supplements like cod liver oil. Over time, the buildup can cause real damage before symptoms become noticeable. By the time fatigue, muscle weakness, or coordination issues appear, significant harm may have already occurred. Compounding this risk is the lack of awareness. Labels on supplements are often confusing, listing vitamin A in different units, IU versus micrograms, making it hard to track how much is being consumed. Older adults may take multiple supplements without realizing they're exceeding the safe limit, 3,000 micrograms, 10,000 IU per day. The liver, responsible for storing vitamin A, can only hold so much. When storage capacity is exceeded, the excess vitamin enters the bloodstream and affects various tissues, especially muscles. It interferes with protein synthesis and damages the neuromuscular junctions, the connections between nerves and muscles. This weakens signal transmission, reducing muscle strength and control. Fatigue is another common symptom. Seniors may feel constantly tired and lack motivation to move. Reduced physical activity then leads to further deconditioning of leg muscles, lowering stamina, and making recovery more difficult, even if supplementation stops. There are numerous real-life cases where seniors suffered from leg weakness, muscle pain, or liver damage due to excessive vitamin A. In one instance, an elderly man misdiagnosed with a neuromuscular disorder was later found to have toxic vitamin A levels. His condition only improved after stopping supplements, though not all damage reversed. Today, medical professionals urge caution with vitamin A. Unless there's a diagnosed deficiency, which is rare in developed countries, supplements are usually unnecessary. A balanced diet, typically provides all the vitamin a person needs. Just half a cup of cooked carrots or a serving of sweet potato can meet daily requirements. For those concerned about vision or immunity, beta-carotene from plant foods is a safer option. The body only converts what it needs, reducing the risk of toxicity. Section 3. Vitamin B6. Vitamin B6, also known as pyridoxine, plays a vital role in maintaining energy levels, supporting cognitive function, and producing neurotransmitters. It's often included in B-complex supplements and promoted for reducing fatigue, brain fog, and low mood. While vitamin B6 is essential in small doses, excessive intake, especially through supplements, can harm the nervous system and muscles, particularly in older adults. As a water-soluble vitamin, B6 is generally believed to be safe, with excess amounts typically excreted in urine. However, vitamin B6 is unique in that it can become toxic when taken in large amounts over long periods. This toxicity can lead to a condition called sensory neuropathy, which affects the nerves responsible for feeling and movement. Symptoms include numbness, tingling, burning sensations, and muscle weakness, especially in the arms and legs. These signs can mimic age-related conditions, making the actual cause difficult to detect. The danger with B6 toxicity is that it develops gradually. A senior may begin taking a daily multivitamin or B-complex supplement, perhaps in combination with fortified foods or energy drinks, without realizing the cumulative effect. Over time, they may begin to lose balance, feel strange sensations in their feet, or develop walking difficulties. Unfortunately, by the time symptoms become obvious and a diagnosis is made, nerve damage may already be permanent. Scientific studies have shown that taking more than 100 milligrams of vitamin B6 per day over an extended period can cause nerve damage. Yet the recommended daily allowance for older adults is only about 1.7 milligrams. This means that some seniors may unknowingly consume doses 50 to 100 times higher than needed. Many supplements contain 50 milligrams, 100 milligrams, or even 200 milligrams of B6 per dose, and because it is included in numerous health products, from immune boosters to sleep aids, unintentional overconsumption is common. A well-known study published in the journal Neurology detailed several cases of older adults suffering from peripheral neuropathy due to high B6 intake. These patients showed signs such as muscle atrophy, poor coordination, and difficulty walking. In some cases, even after stopping the supplement, the damage remained. The study urged healthcare providers to increase awareness about B6 toxicity, especially in patients over 60. The biological explanation for this lies in the way high doses of B6 damage peripheral nerves. These nerves carry messages between the brain, spinal cord, and limbs. When damaged, the connection weakens, resulting in numbness, instability, and weakness, particularly in the lower body. Seniors with existing conditions like diabetes or arthritis may wrongly attribute these symptoms to their chronic illnesses, delaying proper diagnosis. Adding to the problem is the lack of regulation in the supplement industry. Labels can be misleading, and many seniors are unaware of how much B6 they are truly consuming. They may believe they're taking a safe dose, not realizing their multivitamin, energy booster, and sleep aid all contain additional B6. The cultural belief that more is better also plays a role, leading to the dangerous assumption that higher vitamin doses offer greater health benefits. Beyond the neurological effects, excess B6 can impair motor coordination and proprioception, the body's ability to sense movement and position. This is particularly dangerous for seniors as it increases their risk of falling. Once mobility is compromised, it often triggers a chain reaction, reduced activity, muscle loss, and increasing dependence on others. The psychological impact can be equally severe. Seniors who experience persistent numbness, imbalance, or weakness may become anxious, depressed, or socially isolated. They might limit movement out of fear of falling, which further weakens muscles and worsens their condition. This downward spiral can quickly erode quality of life. Fortunately, B6 toxicity is entirely preventable. Most people, including seniors, can meet their daily B6 needs through a balanced diet. Foods like poultry, bananas, potatoes, fortified cereals, and legumes provide sufficient amounts. Unless a deficiency is diagnosed by a healthcare provider, there's no need for high-dose supplements. Doctors are becoming more vigilant about this issue, especially with geriatric patients. Many now recommend reviewing all supplements and medications during annual checkups. This allows early detection of harmful interactions and helps tailor vitamin intake to individual needs. If you or someone you know is experiencing unexplained leg weakness, numbness, or balance issues, consider reviewing supplement use. Discontinue high-dose B6 products and consult a medical professional. Blood tests can measure B6 levels, and nerve studies can assess nerve function. As we age, maintaining strength, especially in our legs, is crucial for independence, balance, and overall mobility. While vitamins are essential for good health, the growing trend of oversupplementation can sometimes do more harm than good. In particular, excess intake of vitamins E, A, B6, and others discussed in this video has been linked to muscle weakness, nerve damage, poor circulation, and impaired coordination, factors that significantly impact leg strength in seniors. Vitamin E, often praised for its antioxidant properties, can interfere with muscle energy production and blood clotting when taken in high doses. Vitamin A, vital for vision and immune function, can weaken bones and muscles when consumed excessively. Similarly, high levels of vitamin B6, although essential for nerve health, can actually cause neuropathy and lead to muscle dysfunction if overused. The key takeaway is this: more is not always better. Seniors should approach supplementation with caution, focusing first on a balanced, nutrient-rich diet and only turning to supplements under medical supervision. Regular checkups, blood tests, and open communication with healthcare providers can help determine what your body truly needs and what it doesn't. Protecting leg strength starts with informed choices. By avoiding unnecessary high-dose vitamin supplements and emphasizing whole food sources, seniors can maintain their mobility, reduce the risk of falls, and enjoy a more active, independent lifestyle. Always remember, the path to better health isn't paved with more pills. It's guided by knowledge, balance, and care.